All right, guys, welcome to Introduction to Anatomy. We're going to talk about the cell, and we're going to talk about terminology. Before you watch this video, make sure that you do your Instructions for Life assignment. So if you haven't done your Instructions for Life assignment, stop here and go do that, and then come back. Once you watch this, you can do your second part of Instructions for Life assignment. So make sure you do part 1 before you watch this video, and part 2 after you watch this video, okay? So we're going to start off with just the cell. Most of the things I talked about with the cell, I'll talk about in class. Make sure you know your organelles of the cell. Go back and look at your biology notes. Review the different, what makes a cell and what's not a cell. You need to have a cell membrane. You need to have cytoplasm, which is pretty much everything in the cell. And you need to have some type of DNA or RNA. In humans, we're eukaryotes, so we hold that DNA inside the nucleus. That's the instructions for making new cells. And you need to understand about the mitochondria, Golgi apparatus, those things come back and hit you a lot. And then things like lysosomes and vacuoles as well. So make sure you review the cell. If you have any questions about it in class, or if you're at home and you got any questions about the cell and you want to shoot me some messages, feel free. But mainly just that surface thing, the organelles and the different cells. And we'll roll on to terminology. So looking at terminology, humans are coelomates. That is C-O-E-L-E-M-8s, coelomates. What a coelom is a hollow internal body cavity. Now, if you look at the history of animals, animals started off being cells piled on top of cells. You had bacteria, you had things like jellyfish, things like coral, things that just there were cells, sheets of cells piled on top of each other. Then the next big things, you had these things called pseudocoelomates, which were roundworms. Roundworms had cells piled on top of each other, but they were kind of folded over, so it looked like there was kind of an open space inside. The next big step was the true coelomates. The animals with layers of cells, but that were folded in such a way you had true internal hollow cavities. Now, the purpose of that is to be able to hang your complicated organs in those cavities. To be complicated, to be macroscopic, you have to have these hollow spaces inside of you. If you've ever been to the doctor and they've taken fingers and done this, they're checking your coelom. They're trying to tell the difference in the hollowness of where your liver should be versus where your liver should not be. And it's kind of get the edges of your organs doing that with percussion. It's just a way to do it because you're hollow on the inside. Since we're hollow, we have different cavities. First off, you have the dorsal cavity. Dorsal cavity is along your back. Humans are odd because we're bipedal. What does that mean?
We walk into legs.
Exactly. Most animals are going to be quadrupeds, and so dorsal usually means the top. But in humans, it doesn't mean the top, it means the back, because we walk upright. Dorsal cavity contains your central nervous system. Central nervous system we'll talk a lot about more at the end of next week when we talk about the nervous system unit. You have your cranial cavity, which is your brain, and your spinal cavity, which includes your spinal cord. Going on down, you have the ventral cavity. Ventral cavity is AKA your chest. That's going to house your lungs and your heart and your esophagus. The thoracic cavity is your heart and lungs, and then your abdominal cavity is going to be in your abdomen, and the border is the diaphragm. So diaphragm, thoracic cavity, abdominal cavity. Thoracic cavity, like I said, is heart and lungs. Abdominal cavity, so much stuff going on in the abdominal cavity that we actually break it up into 4 quadrants. Right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. One of the things about terminology is right and left are always the patient. They're always who you're talking about. So whether you're looking at the person or you are the person, right is always right and left is always left. Some big things about the quadrants. Most important organ in your right upper quadrant? I already mentioned it. Big giant organ right here.
Spleen?
Kind of brownish.
Liver.
Yeah. Okay. Said spleen. Spleen's going to be on your left upper quadrant. Left upper quadrant. It's a big thing that's different about cats and humans. Human spleen is about kidney sized. It's kind of like that. Cats' spleens like cover their whole side of their abdomen. Left lower quadrant is going to be your sigmoid colon. If you have some type of compaction, concretion, if you're having problems with constipation, you deal with pain in the left lower quadrant. Whereas right lower quadrant, it's classic showing up at the emergency room, have right lower quadrant pain. Doctor comes over and says, does that make it better and worse? When I push on it, I said, ooh, that makes it feel okay. And then the doctor does this, and I'm like, oh my God, that hurts so bad. It's called rebound pain. Rebound pain in your right lower quadrant. What's the diagnosis?
Appendicitis.
Appendicitis. Obviously, you would confirm it, but that's classic presentation. It's where your appendix is, it's where your small intestine ends and your large intestine begins. Rolling on, specialized cavities. You have your digestive tract. Digestive tract isn't even called a cavity because it technically, from an immune system standpoint, exists outside of your body. It's kind of gross, but I know you've all seen the meme picture of the human centipede with the person and the tract going through the body. That's kind of the way it is. It's this open tract that runs through your entire body, and that's why you don't want to get stabbed in the stomach, because then you open those bacteria up to the rest of your body. Because from an immune system standpoint, your mouth, your anus, your stomach, your appendix, but your intestines are all technically outside of your body, even though it's housed inside of your body. So digestive tract, that continuous tract from your mouth to your anus. You have your nasal cavity, pretty straightforward. Nasal cavity is not just your nose, it's also your sinuses, goes to the side, goes up, goes back, all that stuff. Orbital cavity holds your eyes, just the open cavity in your skull where your eyes exist. Nice big orbital cavity, nasal cavity right there. Then you have your middle ear cavity. It's a little bitty guy, but it houses those 3 bones of hearing. Then you have your synovial cavities. So synovial cavities all over your body. Synovial cavities you can show off to anybody if they want to see them. That's a synovial cavity. What I did there is I just took a nitrogen bubble and I popped it through my synovial cavity. So that's all you're doing when you pop a knuckle or something like that. Synovial cavities are just where your joints are, houses that synovial fluid, keeps things cushioned so you don't have bone on top of bone. All right. So everything else is how we talk about anatomical terminology. The reason we did the activity where you gave instructions is to demonstrate how difficult it was to write instructions when no one has a starting point. It's easy to say pick up that pencil if people know how to pick things up and if people know what a pencil is. But if you didn't know all of the intricate movements to pick up a pencil, it's hard to describe that movement. And that was the purpose of the activity that you guys have done up to this point. That being said, that's why you need this anatomical terminology, so that the same words can be used every time, and then no matter how you're saying it, you can use the same terms and people know what you're talking about. So you can probably guess that part 2 of your instructions for life is going to be rewrite what you wrote, but using the correct terminology so that it can be very, very consistent and easy to understand. Okay? So first off is anatomical position. We have to have a starting point. You have to have a starting point, anatomical position. There you go. It's standing straight up, eyes forward. The key thing, kind of the weird thing, is palms facing forward. Thumbs lateral to the sides, palms forward, arms and legs are both down, eyes facing ahead. There's a big controversy in my between 2 anatomy teachers when I was in college of what the correct anatomical position of the penis is, but I'll let you do that research on your own. One said erect, one said flaccid, oh well. Okay? All right, so we have anatomical position. Obviously, you're not going to show up and see a patient like this. So we need some terms for how we find a patient. That's where we come in with prone and supine. Prone will be laying face down, supine, laying face up. Easy way to remember it is supine, you are laying on your spine. Supine on the spine. prone, face down. Then we have terms of relationship, talking about more than one thing or talking about maybe where a foreign object is in relation to something else on your body. Anterior is closer to the front of the body. Anterior is closer to this side of the body. The nose is anterior to the orbital socket, in front of it. Okay? Your toes are anterior to your heel. Anterior just means towards the front. Opposite is posterior. Posterior, your heel is posterior to your toes. Posterior is towards the back. Then you go on up and down, you have superior and inferior. Superior towards the head, inferior towards the feet. Now, superior and inferior are kind of weird words because, like I said, the difference between bipeds and quadrupeds. Superior in a quadruped would be dorsal, towards the back. But in a human, in a biped, superior is always going to be towards the head. We have superior and inferior, then we have medial and lateral. Medial is towards the midline. Midline is right down your body. Now, we have a midline because there's 3 different forms of symmetry in animals. Taking us back to biology just a little bit. Remember that at all? First symmetry was asymmetrical organisms. What does that mean?
Not even.
There's no symmetry.
Yeah.
They're just blobs. You know, a coral going all in different directions is asymmetrical. Then the second form of symmetry that came about in animals was radial symmetry. What does that mean?
It means it's symmetrical all the way around.
Pretty much symmetrical all the way around because it's shaped like a
Circle.
a jellyfish, a starfish, a sand dollar, a polyp. Those are all radial symmetry. But most complicated, complex organisms today have not asymmetry, not radial symmetry, but bilateral symmetry. Bilateral symmetry, 2 for bi, lateral means sides. You have 2 sides. You have 2 eyes, 2 ears, 2 nostrils, 2 arms, 2 legs. Odds are if you got something on the right side of your body, you got something else on your left side of your body. It's bilateral symmetry. Since we have that, then we have a midline that goes right down our center. Closer to the midline is medial. Closer to the outside, or farther from the midline, is lateral. This is where you get the word lateral plays in football. Okay, technically it means backwards in football, but most of the time the word lateral in football came from the fact that you were throwing it to the side. Medial towards the middle, lateral towards the side. Okay, your hands and your feet are different because they move all around, and so we have to have a special terms for both of them. So for your hands, it's going to be your palmar surface, which is the anterior surface of your hand, palmar, and then the opposite is your dorsum. Palmar surface, dorsum. Okay? For your feet, you stand on and you walk on your plantar surface. Plantar fasciitis is where you get inflammation of your fascia on the bottom of your feet. Plantar's wart is where you have a wart on the bottom of your feet. Plantar surface. And then the same word for the hand is used for the feet. The top of the foot is called the dorsum. Dorsum of your foot. Terms of relationship?
I already knew a lot of these because I took, what is it called?
Yeah, we do in health science too, or sport unit.
Health science one.
Rock and roll.
Yeah.
Okay? Carrying on. So sometimes you compare 2 things in the body rather than just talk about the relationship of 2 things. One of the things, especially when you talk about muscles, are talking about proximal and distal. Proximal means close to the beginning of, distal means far from the beginning of, or the origin of. So if you look at your arm here, the elbow is proximal to the wrist. The pinky is distal to the wrist. Distal, farther from, proximal, closer to the middle. You can also do it with a tube, like the digestive system. The mouth is the most proximal part of the digestive system. The anus is the most distal part of the digestive system because it's at the end. So proximal versus distal. Then you can also have superficial or deep. Superficial, if you ever had a tuberculosis skin test, that is a superficial injection. They go underneath the first layer of skin and inject it right there on the top of the skin. Whereas if you ever had an intraperitoneal injection, they go in the deepest can be right into your gut. IP injection is going to be deep, far from the surface of the skin. All right, anatomical planes are kind of hard to describe without looking at them in a book. So feel free to look at them in a book, but I'm going to do my best here. The sagittal plane is the vertical plane. It goes from front to back, including the midline. So a sagittal plane is going to be cut in half. It'd be kind of looking like a profile. So if I was to slice down the middle of the body, you would get a sagittal plane, profile plane. Coronal plane is looking straight on. Looking straight on would be a slice down from side to side, and so you get that coronal plane. The way I've always remembered it is if you put on a crown, you take your hands and you put it on like that, side to side. You don't put on a crown like that. You put on a crown side to side. Coronal plane, sagittal plane.
It has nothing to do with corona.
It has nothing to do with corona, but they have the same root word. Okay? And you have transverse planes.
Yeah.
Transverse planes are just slices down the body. There's a lot of transverse planes in your anatomy books, especially when you get into the digestive system where they take a slice just in the middle, that transverse plane. And then any other plane, which you'll hardly ever hear or see unless it's like some pathology, which is bad, illness, oblique planes, or any other angle that's crooked or straight. Okay? All right, let's move some muscles. Probably the part of this that you're going to use the most when writing your descriptions, this right here. Because you've got to move, and to be able to tell somebody how to move, use these words. Origin and insertion. Origin is usually more proximal. Insertion is usually more distal. Origin is usually the part of the muscle that doesn't move, and insertion is usually the part of the muscle that does move. So if you have your bicep here, the origin of the bicep is going to be up here on the shoulder. The insertion is going to be on the radius. So when you flex your bicep, the shoulder doesn't move, but the radius gets pulled. Make sense? Origin stays still, insertion gets moved. Okay? Flexion. Anytime you decrease an angle. Flexion. Flexion. Anytime you take an angle, 180 degrees, and make it less. When you say to flex something, you need to be specific how much. So if you say flex at the elbow, then you need to say flex at the elbow 180 degrees. Flex close to it. Flex at the elbow 90 degrees. Flex at the elbow 45 degrees. You need to be very specific when you say how much you're flexing when you write your instructions. Opposite of flexion is extension. Extension is increasing an angle. So if I'm here at 45 degrees and I extend, bam. When we do these muscles, we're not going to be specific on these muscles. There's 6 or 7 muscles here and 6 or 7 muscles here. These are the flexors because they do this. They decrease angles. And these are the extensors because they extend. They increase the angle. Okay? Increasing angle. So decreasing angle flexion, increasing angle extension. Usually you're only going to use those on joints that only move one direction. So you really wouldn't say flex here because you can go more than one direction. But you can flex there. You can wrist pretty much. I mean, you don't have as much side to side movement, especially if you have wrist surgery. But you can say flex and extend the wrist.
Okay. Or your knees.
Knees, flexion and extension. So we have flexion and extension of the knees as well. Absolutely. Okay? One that really confuses people a lot is abduction and adduction. And I'll be honest with you, those are different words by one letter, but they're opposites. Whenever I say them and I'm trying to convey what I mean, I usually just straight up say abduction or adduction, just because they sound so similar. Okay? So abduction is pulling things apart. I'll demonstrate again. Hand together, abduction, bam. Abduction, bam. We took things away, we pulled pieces apart. And there's actually an abductor muscle in your eye that like pulls the eye a little bit out to the side while the other things are holding it in. I'll never forget, in medical school, we had a student that asked the professor to demonstrate abduction and adduction of the eye, and they were like, but you do got muscles that are doing that. But yeah, so adduction, the easy way to remember it, a deduction is adding, so you're bringing things together. Abduction, adduction. Abduction, adduction.
Or you could literally just think about a UFO pulling something away from the Earth.
And how does that help you with adduction and adduction?
Because it's called abduction.
Oh, okay, wow, okay. Hey, you're my hero, Brandon. You're abducting things away. I've never thought about that just because I've always thought add is adding. You're the man, very good, buddy. All right, rotation is anytime you move around a long axis. Long axis is where you have something long and skinny. Long axis, long axis, long axis. Okay, so rotation would be R, or even you could do that. Anytime you're moving along or kind of opposite from the long axis is rotation, okay? Circumduction is circular movement. So you have circumduction, where you can get a full circular movement. You have circumduction in your fingers, actually. You do a little bit in your wrist, in your neck. A circular movement at your hip joint. You can get circular movement, circumduction. Pronation and supination are specialized rotations. Depends on which direction you're going here. Okay, so starting at the anatomical position, pronation would be taking your palm and turning it back. Usually we don't think about our arms down here though. Usually we think about our arms up here. So pronation, supination. Way I've always remembered it, if I wanted to carry a bowl of soup, I would supinate, bowl of soup. But if you're a pro, you can carry it like that. Pronation, supination. Pronate, supinate. All right, inversion and eversion is why I have the camera back a little bit. So I might actually step a little bit up here so you can see everything. Inversion and eversion are all about your ankle. So use it a lot for sports med, for football. Inversion is going to be ankle, the plantar surface of your foot going medially, and then eversion, plantar surface of the foot going lateral.
They both hurt.
They both hurt, but they're both going to be very, very different, which is why the trainer is going to ask you which way did it go. Inversion and eversion. Okay? All right, protraction and retraction are kind of strange because there's not many things on your body that can protract and retract. It pretty much means moving out and moving back in. The example I have up here on the front has to do with your tongue. Protraction, sticking your tongue out. Retraction, bringing your tongue back in. And there's a couple other examples. Most protraction and retraction are actually going to be microscopic or inside your body when things go in and out of like sphincter muscles protract and retract. But externally, really the only example is your tongue going in and out. I think that might be it, guys. Questions? All right, so we got the things that we need. You have the terms. Go back to your instructions and rework those instructions using these correct terms. If you have any questions at all, don't hesitate to hit me up on the on any messaging system that you happen to be able to have it on. Rock and roll. See y'all guys later on.
I can't believe you ever thought of the UFO thing.
I've